Thanks, Claudette. Appreciate everybody coming this afternoon. Would like to share with you a little bit about how we've developed this application and where we see it going in the future. The mission of our organization is to care, to comfort, assess, restore, and educate to support the health of our patients. And the word care is built right into the name of our application. And our entire organization is supportive of us moving forward. The CEO, the senior team, the board. They're very committed to this application changing the focus of our organization and changing the way we care for our patients. Our CEO's perspective has been a large part of us moving forward with this application. And it's trickled both up and down in our organization. And so our goals, the goals that support our mission to care, include reducing the variability of care. And the patient portal achieves that for us because it empowers patients to demand evidence-based care. We're providing them with information, as you can see from what Claudette presented, of things that come from the Canadian Cancer Society, things that have been tested by research. Patients actually have the opportunity to use that information to be able to assess their own status of their health, and then when they come and talk to their care providers, they're in a position to interact with them on a much, much more solid ground, much more informed. We're also looking at integrating care. So the patient portal is helping us to reduce duplication. You can see in the portal, patients are inputting their own information. Hopefully that's going to reduce some of the demand for health services that are actually going to be required of that individual. And I'll talk about that a little bit further. And at the same time, we're looking at integrating the care of the patient to make the patient's experience more effective from the perspective of the care they actually receive. And so you've got healthcare providers that are giving the patient information from different places. The patient can actually use that information in helping and being an active member of the healthcare team. There's two main approaches we're taking to achieve this in our organization. First is to leverage existing IT investments that we have within our organization. We've invested over the past 5 or 6 years extensively in systems for healthcare providers. Those systems are very provider-centric. I'm going to talk about that as well. But at the same time, we've been able to leverage those systems. So for example, the scheduling system that you saw when Claudette went to it, we didn't have to rebuild a scheduling system. We're just displaying that information to the patient and making it accessible to them. Claudette's talked about results delivery. We're going to take our existing clinical systems and just push that information to the patient through those systems. The beauty for us of this environment where the patient portal is built is it's in exactly the same infrastructure as the viewing tool that we're offering to our physicians. So we don't have to train our IT staff to manage two different environments. That knowledge already exists within our environment. And we're able to do and provide the patient portal for a much cheaper cost than we could if we had to just have a separate standalone application. The second thing that we're doing is we're integrating information. So we're leveraging information from within our own facility. This is an open system, so we're also going to be able to leverage information coming from other care providers and other facilities, both within our region and, quite frankly, from wherever the patient is receiving their clinical services. And as well, we're demanding, expecting, engaging the patient to actually start to contribute to this source of information so that when the patient's sitting down and talking to the care providers or to their care team, they're bringing information to the table about not just what happens when they're specifically in the healthcare environment, but about what happened the last 2 weeks when they were at home. Whether it's fatigue, whether it's nausea, whether it's their fluid levels, they're able to present that information in a comprehensive way that helps the care team and them move forward. Key success factors for this project. 3 that I want to touch on. The first is a clearly defined need. In December of 2003, the Canadian Cancer Society did a survey, and 91% of patients said they did not have enough information about their disease or about how to manage their disease. This application gives them that information, starts to give them the kinds of things that they're looking for. This application's also been a part of our IT strategic plan for the past 3 years, where we wanted to connect patients more definitively to our organization through the web. We're now able to do that. The second key success factor is having a dynamic project team. And so you've actually seen Claudette, a clinical director who ran our pediatric and special care nursery program for many years, understands the needs and the demands of patients in managing their care and in helping to provide care to their family members. So that's where this project's come from. The team expanded to being very multidisciplinary in our organization. Physicians, clinicians, people in our research department, obviously technical people. It's been very exciting in our environment and has moved forward very rapidly because, again, the focus is on the patient. The third key success factor is strategic partnerships. We started, obviously, with McKesson and their experience in the field, their experience in our environment from a provider perspective, helping us to move more to being patient-centric. Other partners, the University of Waterloo, Dominic spoke to some of the research that we're doing to help demonstrate the value of this application. And the partnerships are continuing to grow. We've got people from XJ Partners here today who've helped us very substantially in moving forward with this application faster. And this application has really been about partnerships and about collaborative partnerships moving forward and really focused on the patient. So we've got the hospital that's been able to contribute from a content perspective and to align some of our business objectives. We've got McKesson Provider Technologies. Again, they've got business objectives and they came to the table with functionality. But really the most important partner in building our application has been the patient's needs, the patient's contributions. We've been able to respond. Again, we've got a very flexible platform that this is built on. So a patient says, I want a discussion board, or I want to move forward with lab results. We've been able to do that and respond very quickly. We're not into some legacy system where we have to go back and every time, A, pay a lot of money, and B, get ourselves in the queue until it can become generally released or anything like that. We've been able to be very, very flexible with the platform that we've been on. And it's been very exciting for us because someone can ask for something and a week later we can turn around and give them that functionality that they're looking for to help manage their care. I want to just give you a bit of 2 slides that will show you the journey that we've been on. Oh, I knew that was going to happen. Okay, went too far. To actually come up with this application. Our CEO went to a rapid development session and he came back and he said, Glenn, you've got 18 people in your IT department. Why can't these people just built something right before my eyes in a 3-hour session. Why aren't you doing that for me? It's kind of like, yeah, okay. It was one of those really enjoyable discussions. But having said that, there were some points, obviously, that he raised that were really valid. And it has led us into this opportunity to look at doing things a little bit more quickly and being more responsive to needs. I then attended a 2-day workshop with the same organization, an organization called Cell Exchange out of the States, linked with MIT. And they, for the past 20 years, have helped businesses leverage technology to meet their business goals. And so it was a really good session for us as an organization to make sure we were doing that, to make sure that we were really using technology for the business that we were in and to focus more on patients. We then were able to take a group from organizations. 6 of us went down to Cambridge and built a prototype. 5 days, worked with 3 other companies, shared the session with them, and were able to, at the end, have an actual functioning prototype, something we could take back to our organization and sell internally to our organization and say, this would really work. This could actually use some of our existing hospital information systems to get better information to the patient and hopefully to shift our model of care. Board approval, business case, and then formal partnership. We weren't in the software development business, obviously. Don't want to be there. It's not our space. Talked to 3 different companies. McKesson came forward with the most at risk and the most experience to actually help us develop this. And as Claudette talked about, in less than 6 months, we were able to be in a position where we had a product that was being used by patients in a pilot study. The technological infrastructure was donated by IBM. Again, partnerships. People coming to the table and saying, this sounds unique. This sounds like something that I'd be interested to be involved in. We've had other industry partners. You saw on the website a couple of drug companies that have come and said, we can see your vision for changing patient care. We'd like to get involved. We then moved forward with the software and the content development and setting the functionality specifications. Went with a pilot group in March of this past year with 10 patients and then live shortly after that. And the feedback that we've got has been incredible. Some of the key things that we're going to be taking a look at as an organization is first and foremost, looking at the impact to patient outcomes. That's one of our main objectives of this project, is to be able to use this application to improve the patient experience, to actually improve outcomes, not just how they're feeling about the organization, but actually change some of their clinical outcomes. We're starting with cancer. We're also taking a look at other disease groups that have a long-standing relationship with our organization, that interact with us very extensively. For outcomes, we're looking at things like unplanned admissions, reducing those unplanned admissions, reducing complication rates, and reducing the variance to the expected care plan, because both the patient and the care team are more informed about the status of their health and where their disease is going, where the management of their disease is going, how their treatment plan is going to unfold before them, and taking some of that variability of care out of the equation that we talked about earlier. We'll be measuring utilization of the site and how well the site actually serves patients. Again, it's very dynamic. We can make changes as we need to based on the responses that we're getting from patients. And we've done some surveys and analysis through phone, and we're getting good positive feedback from patients, and we're able to make those changes. We currently have about 357 patients activated on the portal, and that number is growing every day. We've got volunteers in our organization that go around with a laptop, sitting down, explaining it to families and patients about how they can use this application. Patient satisfaction. So what things work for the patient, what things don't work for the patient. We're not going to put our time and energy into parts of the portal that nobody's using or that people don't like. The perception of control. Probably second to patient outcomes, perception of control is one of the most important things we want to measure. As Claudette talked about, when a patient's overloaded with all of that information, they walk out of the doors of our cancer center and they have no idea of what their life is going to be like in the next days, weeks, and months. We want to change that for the patient, and we're going to measure that very specifically to try and give them confidence as they go through this process of managing their disease. We're taking a look at staff satisfaction. If our care team, in a 20-minute appointment, can get a lot more understanding as to what the patient's condition is like, they can provide more effective treatments, more effective drug orders, more effective chemotherapy regimes to make the patient outcome improve. That's what that care team's there for. We're going to be able to do that with the patient portal. Return on investment. This application was built on a business case, taking a look at two things specifically: operational efficiencies within the healthcare environment, specifically within our own hospital, and secondly, taking a look at new revenue opportunities that we haven't leveraged as an organization. On the operational efficiency side, we're taking a look at things like reducing admissions. If we can have a patient who's managing their care and more engaged in their care, recognize the fact that if they continue to have nausea at a certain level, we're trying to catch that at the point where they would actually pick up the phone, call the clinic during the day when there's a team of people there to treat their nausea, instead of having it to the point where they actually have to call their neighbor because they're on the floor in the bathroom and have to take them into our emergency department and get admitted. We can actually change the utilization in the healthcare system and improve it. And as an acute care hospital, we need to be looking at ways to do that. And we need to be able to support our patients in doing that, not just cutting off the service, but actually facilitating it for people. The patient portal is going to help us to do that. There's other areas of operational efficiencies: decreased missed appointments, more efficient use of the clinician's time. We might be able to reduce that 20-minute appointment down to 10 minutes. Patients don't like hanging around our clinic. If we can get them in, get them out, get them the services that they need because we've zeroed in on the problem of the last 2 weeks instead of kind of danced around it, then we're going to be more efficient. All of our clinicians, the physicians in our cancer center, have wireless laptops. They're sitting in a treatment room talking to the patient. All they need to do is spin that laptop around and let the patient access the web, pull up their portal and say, this is what nausea and fatigue looked like for me for the last 2 weeks. Do something about it. Get my pain medication right. Get me the treatments that I need so I'm not feeling like this for the next 2 weeks. The second area is access to new revenue. We have a retail pharmacy. We're only serving about 20% of the cancer patients that come to our facility through our retail pharmacy. We're missing out on that revenue. Those revenues for us go back into hospital operations. We need to capture that. We need to do a better job of that. As well, we've got a web space now. We're talking to local businesses and local service providers, such as, making it up, idelivergroceries.com. You're going to be really sick for a 2-week period. How are you going to get out to get your apple juice? You're not going to be able to do that. Who's going to shovel your driveway? You can look ahead in your schedule and know there's no way I'm going to be well enough in the middle of February to shovel my driveway. Okay, so we've got utilityservices.com there that can give you some help to manage your tasks of daily living. And as well, we've got sponsors, people that are interested in just advertising their product through the site. Future development, further protocol development. Claudette's done a huge amount of work on cancer. We've just had the discussion with the renal program. We serve 300 renal patients. That doesn't sound like very many. Those 300 renal patients that come 3 times a week to get dialysis services for the rest of their life consume $15 million of our $220 million hospital budget. If there's a way through the patient portal that I can serve that group of 300 patients better, make their clinical outcomes more effective, it's going to have incredible impacts for our organization. So we're very actively targeting other groups. Diabetes is another one. We have a large stroke population. We have patients in our special care nursery that sometimes have to stay for up to 2 to 3 months. We want to be able to provide better services to those families and to those patients. We're also looking at results delivery very actively. We hope that probably early in the new year we're going to be in a position to deliver lab results to people. Again, these are people with chronic conditions that know what it means when they get platelet counts of X or know what their white blood cells are. We're going to be able to get that information to the patients. The barrier is not a technical barrier. It's a cultural barrier. It's, how's the physician going to react when possibly at the same time that they're getting those results, the patient's getting the results? And so we're looking at technical solutions where when the physician's delivered the result, he's getting a pop-up box in his application that says, are you willing to release these results to the patient because they're on the patient portal? Click, yes. Boom, those results go to those patients. Or no, but then the physician's flagged a little bit, I need to talk to the patient about those results. And we're not just looking at lab. Patients are interested in their X-ray reports. They're interested in their pathology reports because they know what those reports mean. Again, when you're managing a disease that's consuming your life. Appointment scheduling expansion. Claudette's talked about that. We're giving people view access right now. You can go online and book your flight. Why can't you book your mammogram through our system? The technology's there. It's actually the shift in our organization to allow people to be able to do that. And we're dreaming into the future. We're dreaming about new partnerships with Cancer Care Ontario as an example, with other healthcare provider agencies, with other organizations that are developing information or services that would be available through the patient portal. We recognize we're just at the very beginning of this journey. We have a lot to learn as an organization. Eventually, we'd like to see the portal being preventative in nature somehow. So you take things like diabetes, or you take renal dialysis, or stroke. How could we be using the portal to actually educate people about their health so that they could be doing preventative things to either delay those things or to prevent them from happening altogether? And finally, but probably most importantly, we really believe that the patient portal will actually change our model of care to shift us from being provider-centric to being patient-centric. And we really believe that the portal is going to be able to do that for us. It needs to happen. And so we're looking at exciting things like possibly the patient portal being the location or the source where the patient would access all of their health information. So whether they're going to our institution or any other institution, that's where their health information is residing. And we really believe that the portal will make the patient empowered to participate in managing their health care, and as well accountable. We know that there's people that don't look after themselves. Again, through the patient portal, they've got a tool, and in some cases, take away the excuse of, I didn't know what to do. I didn't know how to react when my fatigue level got to this certain point. We're really going to be empowering patients to manage their care better and to bring them in as a real and active member of the healthcare team. And we're going to change things in our organization because patients are going to walk in demanding that we treat them in an evidence-based fashion. And the portal is going to help us to get there. Thank you for your time today. I want to thank Dominic for having us. And we're open for some questions.